So back in 1995, I came down with a muscular illness. I actually got to the point where I couldn't walk and I couldn't lift my arms to comb my hair. And for 18 months, I went to multiple doctors to find out what was wrong, and nobody had an answer. I'd been very athletic through all my life, and I just had no muscular strength left. So one of the things that I did was I had done some research and I wanted to get the amalgam fillings taken out of my mouth. So to give you some information, at that time back in 1995, amalgam fillings and the information that was out at that time isn't what is available at this time. So I had gone to my insurance company, our extended healthcare benefits through my husband's work, which was Great West Life at the time. And they said, no, we're not covering it. You're doing it for cosmetic reasons. My husband and I made the decision that we were going to go ahead and try and do it because it was linked to some of the symptoms that I was having. So while I was having my amalgam fillings extracted, they put a little tray in front, and on the tray was a vial that had like a biohazard label on it. The doctor and the assistant, the dental assistant, they had different masks on, different gloves on than they would normally have on. So when I was done and they were putting my amalgam fillings in these little vials with the biohazard label on it, I was like, well, why did you have to do that? So the dentist explained that they couldn't just throw the amalgam fillings away, that they were considered toxic waste. So I'm like, well, if it's considered toxic waste out of my mouth, is it not considered toxic waste in my mouth? So I actually wouldn't leave my dentist's office until they wrote me a letter. Yeah, I'm that kind of person. So the dentist actually did say that the patient is very concerned about amalgam restoration, especially since she knows that we must dispose of amalgam as toxic waste. So that letter went into my to Great West Life, and they accepted it, and then they paid for the extractions because of that, because I had proved that it was toxic waste. So to make a long story short, when I had the amalgam fillings taken out, and it was all due to an accident that I had when I was 4 years old. I had a head trauma, which then made all my 6-year filler my 6-year molars not as strong as they should be, so they all had issues, and so I ended up having a root canal. And at the time I did not know what I know now, and I would never get another root canal, but I had to have that root canal extracted taken out. I had that completely removed, the root canal last year, 2019, in the summertime. So during that time, again, I got my options were to put a peg in and a tooth in, or to have a partial denture. And I went with the partial denture, again, thinking everything would be okay with that. So after 3 days of having the partial denture, so this is, it was just one tooth, so it's just to fill in the spot, right? So you can't see that it's a gap. So it's a partial denture just with one tooth. And the reason why I'm showing you this, because I believe many, many people have something like this type of an apparatus. So after about 3 days, I started to have this really horrid taste in my mouth. And so I went to the dentist and I said, what is this made out of? And so the information that I got was it was actually made out of chromium cobalt. And so I'm thinking that doesn't sound very good. And because I do know about the periodic table because of homeopathic medicine, I'm like, that's not very good at all. So I did a little bit of research, and cobalt poisoning, they actually have class action suits out right now because many people who had hip replacements, the hip replacement was made out of cobalt or chromium cobalt. So people were getting cancer because of the hip replacement, because of the material, the cobalt, the chromium cobalt that is in the hip replacement. So you can look that up. And what's interesting is after I had got this information from my dentist that my partial denture was made out of that, I actually had a patient come in with cancer who actually went through that, was in the class action suit, who actually their cobalt levels were like so astronomically high, and they had cancer. They had a blood cancer, a tumor right around the hip, where the hip replacement was, and where that cobalt, chromium cobalt joint was, and they got cancer. And so why I'm telling you this is for information. So the thing about a partial denture is mine actually went underneath my tongue around the front. It was comfortable. I didn't even feel that it was on there, except that I could tell that I kept having this horrid taste in my mouth. And so if underneath the tongue is the most susceptible place for anything to go directly into your bloodstream. So if it took, if people were not using, if people that were doing hip replacements now changed from chromium cobalt to titanium, because of the poisoning from chromium cobalt, why is it still being used as a partial denture? So I approached my dentist with this, and they said, they've talked to the Dental Association. This is absolutely safe. It is baked, and so it has a coating on it, so it can't leak into your system. I'm like, no, it can leak into your system, and underneath your tongue, again, is the most susceptible place to go directly into your bloodstream. That's how homeopathic medicine is utilized. You put it underneath your tongue, and the energy from the medicine goes directly into your bloodstream. So that's how homeopathic medicine works. So I know that. So I just wanted to inform you that if you have any partial dentures, you should probably check to see what they're made of, because if they're chromium cobalt, you probably want to get that changed. And I think these should be banned. If they are class action suits from hip replacements, why are they still being used? And they go directly into your mouth, underneath your directly into your bloodstream. So a little bit of information. Hope it's helpful to some people. And remember, a happy heart is good medicine. Bye.